Are you having a knee replacement surgery in the near future, or have you already had a knee replacement surgery? In this video, I'm going to explain to you key strategies to reducing your knee pain, improving your strength, improving your mobility, and rehabilitating quicker so you can get back on your feet sooner. Hi, my name's Jeff LaBianco with Ask Dr. L Whole Personal Development, and I've been a physical therapist for 18 years. I've worked in inpatient hospitals, I've worked in home health, I've worked in outpatient. So I've rehabilitated patients from day one all the way up to 3 months out. And I'd like to share with you the key strategies you need to know to improve your overall rehabilitation process. First, let's start with post-op day one. Now, believe it or not, on day one post-op or day one after surgery, you're going to be walking, okay? Your physical therapist is going to come into your room and ask you to walk. And believe me, it will be scary, but it will work. Do me a favor, follow the physical therapist's advice. You're going to have that nerve block that will reduce the pain for a short while. You want to take advantage of that and get up for the therapist and start walking. That initial walking is going to set the stage for your future rehab. The therapist will give you some light exercises such as ankle pumps, possibly quad sets, glute sets, and I'll be showing you those in a few minutes. Definitely perform them in your bed when you can, at least 3 times a day. 3 sets of 10 would be the goal. You also want to make sure that you elevate your knee with the pillows and put ice on it for about 20 minutes. And do that whenever you have discomfort. Now, the thing is, I've had a lot of patients say to me, well, I didn't want to ring my call button because that would bother the nurses. Let me tell you this, all nurses, they're very compassionate and they want to help you, but they won't know to help you unless you ring that call button. So please, ring the button, ask for the ice, ring the button, ask them to prop pillows under your knee to bring your knee above your heart in order to reduce the swelling. Now, there's going to be a lot of swelling. Don't get overwhelmed by that. Your body is actually healing your knee, so you need swelling to heal. If you're not feeling comfortable in bed, ring that button and allow them to position you so you're comfortable, so you can sleep more, because sleep is very important as well. Your body needs to heal. You need to eat, you need to drink, you need to sleep, and you need to exercise with the therapist. Once you've spent about 1 to 2 or 3 days max in a hospital, you're then going to go to an inpatient rehab hospital where you will spend about a week or 2 improving your overall function and in order to return home safely. Now, you'll be working with a physical therapist and an occupational therapist, and you'll be working for 3 hours a day, okay? Sounds like a lot, but in the span of a 12-hour window, right, the time that you're awake, you can definitely do it. I have patients asking me this all the time. What's the difference between a physical therapist and an occupational therapist? Well, physical therapists focus the most on improving that knee mobility, getting it to straighten completely and stretch completely. After the 1 to 2 weeks, you're not going to be stretching it 100%. We're hoping to get it straight 100%, but we'll continue working on that throughout the weeks and months. The occupational therapist works more on hygiene as well as dressing, upper and lower body dressing, as well as bathing, making sure you can take a shower without falling. The both of us really work together. We work on bed mobility, moving in bed safely, transferring from bed to wheelchair or to walker, and working on overall balance so that you can return home without the risk of falling. After the inpatient rehab hospital, what you'll be doing is you'll be going to a home health physical therapy or outpatient physical therapy. Now, the team will determine what's best for you. Okay, you have your physicians, your nurses, your case managers, your physical therapists, occupational therapists, you have your pharmacists, you have your certified nursing assistants, helping you. You have everyone on your side, and the whole team will determine what's best for you. When you go to home health, basically you'll return home, and physical therapists and occupational therapists, and possibly nursing if needed, will come to your house and work with you 2 to 3 times a week for about an hour. Now, by then you'll have a really good home exercise program to work on daily. I would recommend working on that program 3 times a day, okay? Morning, noon, or afternoon, and evening/night. By doing that, you're going to stay consistent, and you're going to keep your knee mobile. And by keeping it mobile, you're going to reduce the pain as well as the swelling and just get yourself back on track quicker. Okay, motion is lotion for the joints. Remember, movement is key, and you want to be consistent. So once you've had that home health where you work with a therapist in your own home, getting more used to your new knee, you'll then move on to outpatient physical therapy. There you'll do more higher functioning exercises, working on getting that knee bend all the way as far as you can, and straightening that knee out if it isn't straight already. You'll be working on more high-level balance exercises. Hopefully by then you won't be using an assisted device such as a walker or cane. But believe me, if you went into a knee surgery using an assisted device such as a walker, you may still be using it after. And that's okay. Everyone's different. The main thing is you get back to the life you want to live with less pain, and you can then enjoy it better, okay? So you do outpatient for another at least 4 weeks, okay? It could be up to 12. It depends. 4 to 12 weeks. Most of my patients, I see them for about 5 weeks in outpatient, and then they're good to go. You know, you'll be walking again, and everything will be fine. Once you're done with outpatient, you go home with an exercise program. And I recommend you continue using that program until you've reached your highest level of function. Now, I want to show you some exercises you can do to start off your rehabilitation in the first few weeks of status post knee replacement. All right, let's go to this bed and I'll show you what to do. The first exercise you're going to do are the ankle pumps. Let me show you how. You're going to lay on your back. Okay, you could prop a few pillows if needed. I'm going to sit up here. And you're going to pump your ankles up and down. Now this is very effective for reducing swelling in your knee, as well as in your ankles and toes and even up to your hip. Remember, your knee was replaced, so you're going to have swelling throughout your whole lower extremity. Now do about 3 sets of 10 of these. You should feel a stretch in your calf when you come back, and a stretch in the front of your lower leg when you come down. And by doing these, it'll help warm you up for the next exercise, which is the glute squeezes, okay? Now what I'm doing is, let me lay down for this, I'm squeezing my glutes together, basically squeezing my butt muscles together. You may not be able to see this too much, but just imagine squeezing your butt muscles together. You're going to do 30 of these. This again is going to help those glutes fire, because when you get up and walk, the glute muscle is very important in ambulation or walking. So get those muscles working as soon as possible. Next exercise, this is very important, the quadriceps. Now, when you have a knee replacement, your knee is most likely not going to straighten out. Let's say it's the right knee. It's not going to straighten out all the way to the bottom because it's tight, it's painful, and we want to improve that. So you bring your knee down as much as you can, and you tighten up the quads. Tighten up these muscles and push your knee down into the bed. Believe me, it won't most likely go down all the way when you first start, but don't worry, just keep doing it, and eventually it'll go all the way down. Next exercise are the heel slides. What you do is you lay down and you bend your knee, or you slide your heel up as far as you can and down. Now, again, this won't be easy. You might not even be able to do it. You might see what I'm doing, this small amount It's okay. You want to just do what you can. You can also get a gait belt, which therapists will be putting around you to support you in order to not lose your balance. Wrap it around your foot and pull up for a little stretch, okay? Just like that. Now, what you can do next is laying down, hip abduction, or basically going out to the side. Again, this will be challenging, but you can do it. If you're unable to do it, don't worry about it. Just try to do it. Follow your therapist, and they will help you through it. So those are the exercises you want to start with, and then just continue with your therapist's advice. One more thing to add, when you're going through therapy, don't get discouraged if some days are worse than others, okay? I tell my patients, it's like the stock market, right? You invest in something, you invest in your health, and it goes up and down. It's a rocky road, but eventually, as long as you're going up in the whole scheme of things, you're doing well. And when you push yourself a lot, the next day you may need a recovery day. Your therapist knows this. Don't feel bad if you're not walking as far as you did before, you're not stretching your knee as far as you did before. Look back a week from now. Do you feel better or worse? That's a great indication. Look back 2 weeks from now. Do you feel better or worse? You'll notice you're feeling a lot better and you're moving in the right direction. Keep moving forward and you'll do great. If you enjoyed this video, then please comment below so that this message can go to everyone who needs it. I hope you enjoyed this video, and I'll see you in the next one.